Welcome to today's press briefing. We have with us from the Center for Health Protection, Dr. Chang Shok-Kwan, and from the Hospital Authority, Dr. Larry Lee. The two doctors will give us an update on the cases, situations, as well as that in the HA. Good afternoon. Yesterday, we have local positive cases, a total of 3,625 cases, including 1,515 PCR positive cases, and verified RAT cases, 2,110 cases. We also have 180 imported cases, including PCR positive cases, 151, RAT positive cases, 29. The Hospital Authority reported one death case. So we have altogether in the fifth wave 9,235 cases. I'll now defer to the Hospital Authority. Currently, we have 1,207 confirmed patients being admitted. 146 of them are new cases. For isolation facilities, we have 337 of them in isolation ward and 224 of them in second-tier wards and 396 of them in the North Lantau Infection Control Center with 120 new cases. Yesterday, we have reported 2 critical cases. They've both have 2 doses, and there are 6 in the serious condition. So far, there are 17 critical conditions and 32 serious conditions. 5 of the critical condition patients are in ICU. There is a 67-year-old male patient that has passed away. He's got 3 doses. He suffered from hypertension and diabetes. This patient, at around 11 p.m., was sent by ambulance to Caritas Hospital A&E department. After resuscitation, he was certified dead. And his cause of death is to do with suicide. His case will be referred to the coroners. Dr. Chang, 180 imported cases, including 68 confirmed at the airport and 102 confirmed at quarantine hotels, and 10 of them have already left quarantine hotels. For the 180 cases, they came from 36 places. 6 of these places have imported over 10 cases. They are the UK, 48 cases, US, 15, Philippines, 14, Thailand, 13, Canada, 15, and India, 11. For the other 30 places, they have imported less than 10 cases. In terms of care homes, we have 4 care homes for the elderly and 2 care homes for people with disabilities with cases. So some close contacts will have to be quarantined. The first care home for the elderly is 松輝護老中心. There is a staff member who is confirmed. 15 residents and 2 staff members have to be quarantined. The other one is in 康樂園護老康樂園護老中心有限公司 in 康樂園. 1 resident is confirmed. 10 residents and 1 staff member have to be quarantined. And for 來來護老中心, there is 1 resident that is confirmed. 3 residents staying at the same place will have to be quarantined. And the other one is 青松觀有限公司青松護理安老院. 1 resident confirmed. 6 people living there and 6 staff members have to be quarantined. There are 2 care homes for people with disability. One is TWGHS Jockey Club 怡安護老院舍. 4 residents have been confirmed. Others will have to be quarantined. The other one is 康欣園. 1 resident confirmed. So we are still looking into this care home to see how many people have to be quarantined. For schools, today is Wednesday, 299 cases. 299 schools reported 364 cases, including 293 students and 71 staff members. They come from 69 kindergartens, 149 primary schools, 80 secondary schools, and 2 special schools. In the past 7 days, 182 schools have reported at least 2 cases. 2 schools will see some of their classes being suspended from teaching. One is Yan Chai Hospital, Lam Pak Yan Secondary School. Class 3B, there are 37 students. 5 of them have been confirmed. 2 are from the same family. This class will have to be suspended for 1 week. The other one is Lutheran Church. Class 6B, 25 students with 3 confirmed cases. So this class will have to be suspended for 1 week. We have been monitoring the prevalence of subvariants in Hong Kong. According to the analysis of our public health laboratory service, as at 18th of July, there are 1,093 suspected BA.2 or confirmed BA.2.12.1 cases. 372 of them are suspected BA.4 or BA.5. We've looked at these cases. The severity of these cases compared to BA.2.2, that is the other variants of Omicron, showed little difference. The WHO said that although currently BA.5 is the most transmissible strain of Omicron and is on its way to replacing all the other subvariants, but they have not spotted any abnormal severity. So in terms of severity, it's very little difference from other subvariants. According to the latest risk assessment, the government has adjusted its case management. So for BA.2.1.1 or BA.4 or 5, that is with L452R or Q, the quarantine arrangements and isolation arrangement is the same as BA.2. That means if they are suspected local positive cases, together with their close contacts, if the home setting is suitable, they may stay at home for quarantine and isolation. The WHO mentions that for these subvariants, there will be further mutation. Vaccination, in particular 3 doses, is effective in reducing risk of death. That covers subvariants, whether it is BA.4 or BA.5. So if you have yet to complete your course or those who have not been vaccinated, please get vaccinated as soon as possible. Early treatment and early diagnosis are also very effective in preventing serious cases. If you suffer from any illness, please see a doctor, get tested. And if need be, you can get medication. We'll continue to monitor BA.4, BA.5 or BA.2 or 0.1.2 or other prevalent subvariants. There are fluctuations every day. For BA.2.12.1 is about 1%, 1.5% to 2% of the total number of cases. Suspected BA.4 or BA.5 is about 0.5 to 1%. We'll closely monitor the situation. That's all for my report today.
In the past day, the HA recorded 126 patients who have recovered and 110 were discharged from hospitals. 3 were detected through admission screening or in-hospital screening, and 12 staff members were classified as close contacts. 75 new staff members tested positive, and the total number of staff members who tested positive was 25,339. Another 39 staff members returned to their posts. A total of 24,824 staff members have returned to their posts. At the male medicine ward of Northern District Hospital, another patient tested positive through screening. It was a 73-year-old male who is currently being isolated. For this ward, a total of 6 patients and 6 staff members have tested positive. Meanwhile, at a rehabilitation ward at Kowloon Hospital, a male patient tested positive through admission screening. Subsequently, the hospital conducted contact tracing, and we identified 2 more patients and 1 staff member from the same ward who tested positive. The ward stopped admitting new patients, and it is being disinfected. The hospital will continue to monitor the health of its patients and staff. That's all from us today. The floor is now open for questions. Please identify your organization before you speak. The gentleman here, this is Now TV. For Leung Pak Yuen Secondary School, 5 students tested positive. Did transmission take place within the class? What was the source of infection, and which student started showing symptoms first? For the fatality, can you tell us more about the cause of death? Did the patient test positive upon admission to hospital? Can you tell us more about the treatment plan? Clusters arising from restaurants are no longer being announced these days. Is it because you were overwhelmed by the workload? For Lung Pai Chong Hall, 5 cases came from 1 family, and there was nothing too remarkable about the transmission of these cases. For the 67-year-old patient, the patient had hypertension and diabetes, and at about 11 p.m. on the 19th, the patient was sent to the A&E ward of Caritas Medical Center. The patient was unconscious at that time, and we learned that the patient tested positive to COVID on the 16th. We performed resuscitation to no avail, and subsequently the patient passed away. We believe the patient committed suicide, and the case was referred to the coroner. As for the background of the patient, you may refer to the Correctional Services Department. Since we have a number of outbreaks within clusters, we have focused our efforts on high-risk groups such as elderly homes and schools. Next question, please. This is TVB. Dr. Chuang, you said that some patients could quarantine at home. How could the patients know which subvariant they contracted, and would you distribute wristbands for these patients, and what would be the arrangements? We would no longer differentiate the quarantine treatments for patients based on the variant, such as BA.2.2 or BA.4.5. For patients who tested positive to COVID, they would provide their particulars, and they would follow our usual arrangements, and wristbands would be distributed. We would not transfer them to quarantine centers based on the variant associated. Next question.
Is it likely that Hong Kong might see 10,000 COVID cases a day if figures continue to surge? And what's your estimation? And can I ask about the change of quarantine rules for local infections for the subvariants? What's the arrangement for them, like the health codes and electronic wristband, for example? Thank you.
We are still seeing a gradual increase in number of cases in the past few weeks. So we expect the cases will be further increasing. So we would like to urge the public to maintain vigilance and wear masks and maintain social distancing measures as far as possible, and obey the prevention and control, our policies in isolation and quarantine.
So for the subvariant, we have analyzed the cases in Hong Kong, and also we note that the World Health Organization also note that there's no severity signal among BA.5, which is regarded as the most transmissible subvariant among all the Omicron variants so far. So that BA.5 has a growth advantage over other subvariants, but we have not observed any increase in severity among those patients suffering from it. Therefore, we will adjust the management of cases suffering from suspected BA.2.12.1, as well as those suspected to be suffering from BA.4 or 5 cases. Their management and isolation and quarantine measures will be the same as any other Omicron cases in Hong Kong. So as well for the electronic wristband and others.
下一題左邊後排嗰位男士。
Next question, please. The gentleman at the back, please. This is AM 730. In terms of compulsory testing notices, you said the primary targets were high-risk places such as schools and residential care homes. For restaurants, are you not going to conduct investigations even if you or identify cases? For BA.4 and .5 cases, you said no differential treatment would be provided. For patients who contracted the BA.2.12.1 or BA.4.5 patients, would they be allowed to undergo home quarantine? For the staff member at Kowloon Hospital who tested positive, which post did he serve, and did the staff member come into contact with patients? The new arrangement would apply to cases identified from today. Those who contracted the new subvariants would not be transferred to quarantine facilities, but those who are already here would have to remain till the end of the quarantine or isolation period. Compulsory testing notices would be based on the number of cases instead of the subvariants involved. For cases detected at buildings or in restaurants, the relevant patients must be isolated and their family members would be quarantined. The staff member at Kowloon Hospital was a patient care assistant. He was responsible for daily care tasks. Next question, please. The lady in front. Good afternoon. This is Ming Pao. I have a question for Dr. Chuang. Some residential care homes indicated that the government plans to tighten anti-epidemic measures at these care homes. Can you tell us more about the trend of cases at these residential care homes over the past 7 days? For Ling Liang Church Kindergarten, for the cluster involving the school bus, were there new cases? Do you provide air ventilation guidelines for school buses? For the new subvariants, can you tell us about the home isolation and quarantine guidelines? Would it be based on the number of bathrooms available? How many cases were related and how many were untraceable? Even though vaccines can reduce the fatality rate and the number of serious complications, what impacts would it have on the subvariant strains? Earlier, it was said that the daily caseload was expected to double to about 6,000, and now the daily caseload is only some 3,000. So is the situation more optimistic than expected?
Whether it is optimistic or pessimistic, the trend is on the rise, and today's figure is higher than that of yesterday or the day before. Our view is that it will continue to climb. We're concerned about the burden it will put on our public health care system. In relation to number of cases at elderly homes, you can see that there is a slight increase in the number of cases among elderly homes. That is at the same rate as the increase in community cases. The pattern is similar. Sometimes the staff members have stayed in the community. There is a chance that they have brought the virus into the elderly homes. Of course, for residents as well as staff members, there can be enhanced testing, which will be conducive to early identification of cases in order to prevent an outbreak. You have fired off a number of questions. Leng Liang Church. We don't have related cases of bus number 18. There may be sporadic cases that may have something to do with it. In relation to the school bus cluster, drivers might have eaten together, or they might have met. So the notice and the announcement. We will, at daily press releases, give information about local number of cases as well as imported cases, but we will not differentiate whether they are related or not. So the criteria for home or community quarantine. There are 5 tiers. Depends on the home setting, on whether there are toilets and whether there is a separate bedroom and whether there are any family members who are high risk. Vaccination. The effectiveness, is rather high, especially for those with 3 doses and for high-risk groups 4 doses. They are very effective against BA4 or 5. The gentleman at the front. I'm from cable TV. BA2, BA4, BA5. People can stay at home under quarantine or isolation. Are you concerned that it would increase the risk of transmission in the community? How many people do you think will be allowed to be isolated at home? Is it a preparation to forestall over capacity of community isolation facilities? What is the current utilization rate? Most of these cases, half of these cases are picked up via RAT. They will receive an isolation order. Then these people will have to do a PCR test. Then we'll know whether it involves a subvariant. When we do, that person has already stayed at home for 2-3 days. Sending them to an isolation facility might not be any more effective. And we start using wristbands for those are being isolated at home to stop them from leaving their home. We think that these measures are more effective in infection control. The capacity of isolation facilities are deferred to the HA. The community isolation facilities are under the purview of the Security Bureau. But for Penny's Bay, there are about 4,400 patients staying there. For hotels, about 600. So far, about 5,000 patients. With home isolation, would it increase the risk of transmission in the community? We've done a lot of work. We have isolation, we have quarantine. And if it's BA4, 5, or BA.2.12.1, the patients will be sent to isolation facilities. We do see a spread of the subvariants, albeit at a slower rate than expected. It is difficult to stop the spread of BA4 or 5, especially given the high transmissibility. A more effective measure is that people who have not completed the course of vaccination or have yet to be vaccinated, please get vaccinated as soon as possible. Our measures have slowed down the rate of transmission. Lady at the back. I'm from Hong Kong Economic Times. For BA.2.12.1 or BA4 or BA5, for the thousands of cases, how many of them are symptomatic? What are these symptoms? Compared to mainstream BA.2.2, any difference in the data or figures? For subvariant cases, what are the age groups? Any serious symptoms? Given the high transmissibility of the new subvariants, how come you're not concerned about that and would be allowed people to stay at home? For Funky Dance Center, we heard that there are dance teachers and students that have been confirmed. Do you have any information about the outbreak of this cluster? For BA.4, BA5, or BA.2.12.1, including imported cases, there are a lot of them that are asymptomatic. Over 60% of them are BA4 or BA5 are symptomatic. About 44% of them BA.2.12.1 that are asymptomatic. If we only look at local cases, more of them are symptomatic. Perhaps it's because you show symptoms and then you take a test. About 16% of them are BA.4 or 5 that are asymptomatic. About 34% are BA.2.12.1 that are asymptomatic. About 50% of the cases are asymptomatic in the community. It seems that there is a slightly more people who are symptomatic, but the most common ones are sore throat and fever. It's still a small number, and we have not detected any major difference in severity. We will monitor announcements made by the WHO because they have a larger data. We have not identified any particular severity. I don't have the information. That's the end of the press briefing. Thank you.